Hi, I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's lecture will be a part of a series on feminizing without surgery, and our topic is breast enlargement and buying a bra. If you are on hormones to improve or increase your breast size, you're going to notice changes that are identical to those that young girls experience in puberty. So first of all, what will happen is that a person develops a breast bud. And this is like a little bean or a lentil-shaped object that fits right underneath the areola, which of course is the colored part of the nipple. And it's tender too, so that you may notice that that's a little bit sore or a little bit tender to touch. The second thing that will happen is that the areola will kind of mound up like a little cone. And then beyond that, breast tissue will fill in around that as the breast develops into a more adult size and contour. So how much breast development is expected? Well, this is going to vary, but we generally are going to see that most women will probably not get much more than a B or a C cup, although there is some variability within this, and we see some real outliers in this department. And we're generally going to see that maximal development occurring within the first 2 to 3 years of being on estradiol and or progesterone. In my experience, there is a subset of women who really do get more breast development with the use of progesterone in addition. It doesn't happen in everybody, but in some people it can be really impressive. And I know that there's even a group of women who is taking their progesterone rectally as a suppository rather than swallowing it. And some of these women are reporting that they are getting better results. To be fair, it's important to remember that genetics plays a huge role in this. If you have mothers and sisters who were well endowed, you might be more well endowed yourself. If, on the other hand, the female relatives in your family didn't have much breast development, I wouldn't count on that for yourself either. It's also fair to say that people's goals vary so widely. Some people want small breasts, other people really want to have enormous breasts that are just not possible with hormones alone. So if you're one of the women who is seeking Dolly Parton breasts, you might want to look up your breast surgeon at this point as well.